However, there's so much more information in there that you can unlock, and I think this is where AI really comes into action. How do you find useful patterns in that data that can be beneficial for the health setting?
Welcome to the Stress Navigation Podcast. In this podcast, we'll talk about stress, science, and daily life. We'll interview experts in the fields of psychology, psychiatry, physiology, genetics, sociology, data analysis, and much more. Hi everybody, Marcos here. Welcome back to Stress Navigation. I'm going to start the episode by sharing some numbers. Around half the global population, 4 billion people, own a smartphone. 500 million people more, or within these people with a smartphone, own a smartwatch. And these numbers are expected to keep growing. These devices allow us for the first time in history to have access to detailed data about ourselves. Think of sleep patterns, physical activity, heart rate, emotions, location, online presence, and much more. We are quantifying ourselves in a way that has never been seen before, generating an overwhelming amount of information. So at Stress in Action, we ask, can we use this data to help us live healthier lives? To detect when we might be going down an undesirable path, to learn more about what does us good. Today, we'll look at the question from an analytical angle. What methods can we use to make sense of this vast sea of data? Our guest, Dr. Mark Hoogendoorn, professor of artificial intelligence at the Vrije Universiteit Amsterdam, specializes in applying machine learning to the domains of health, disease, and well-being. He even co-authored a book on the topic, Machine Learning for the Quantified Self, which is why I think Mark is a great person to explore this topic with. So hi, Mark. Very nice to have you here. How you doing?
Doing fine, thanks. Thanks a lot for the invitation. Excited to talk about this topic for sure. Yeah.
Great. So let's begin. You are an expert in machine learning and artificial intelligence. Could you give us a layman's understanding of these terms?
Certainly. So if you look at AI in general, which is, let's say, the overarching field, then that's typically about making computers more intelligent or letting them behave intelligent. And hereby it's always a bit of a tricky question, what is intelligence then? So I think a nice definition that came from Niels Nielsen is to say that these computers can then act in a proper way in their environment and also with foresight. So I think this is typically how people sort of operationalize this intelligence. Mm-hmm. And then within AI, which is a very broad domain, you have machine learning. And I think this is what you often hear news items on, that are so impressive developments. And machine learning is really about sort of finding patterns in data. So that's one of the techniques within the domain of AI.
Okay.
I think this would be my sort of high-level explanation.
That's great. So defining patterns in data, how does this apply to healthcare, to health sciences?
Well, if you look at how much data is being generated, so you already referred to that in your introduction, right? So we wear wearables, but also in hospitals, there's so much data being generated. And of course, doctors use that data to make decisions, and also people that wear wearables, probably they are influenced by it in a certain way. However, there's so much more information in there that you can unlock in a way, and I think this is where AI really comes into action, or machine learning specifically as well. How do you find useful patterns in that data that can be beneficial for the health setting? So.
And what kind of examples, data types are you working with in this context?
So actually within the group we have a lot of different types of data that we work with. Of course you have the wearables, including Stress in Action, where you're also working in, and of course where this podcast is for, but also electronic patient records that we're working with. And in there you also have a richness of data. We, for example, collaborate with intensive care, so you can imagine.
So what does that look like, working with intensive care machine learning?
So I think there you really have a very dense amount of data, because these patients lie on monitors. So every minute you get a huge amount of data in around these patients. They have a lot of lab results. So it's really interesting, because these patients are obviously very sick, and therefore trying to see how you can use that data, for example, for a more effective treatment, I think is really interesting. And also there is a lot of data to learn from. So, and also as the intensivists themselves say, we don't always know which intervention is best for a specific patient. Of course, they have the experience based on their training, but also based on seeing a lot of patients. But if you can actually look at a lot of patients that are so many that this cannot be seen by a single intensivist, then you might be able to extract even more complex patterns and even try to make an even better choice in intervention. So I think this is really great, and I think this interaction with such experts really makes it, for me, inspiring to work with such data that we can really help patients, but also the clinicians.
So the human eye can't really see all of these patterns with all of this data, but it is the human eye that kind of feeds our idea of what we're looking for.
Yeah, I think that is how you can phrase it. So I think this is also the way to go about using AI, right? So we could say, well, let's just use AI for whatever it can potentially be useful. But I think working together with health experts can really help you to understand, like, what are the challenges that we should be solving. And I don't think it should necessarily replace a health expert, but it should help the health expert to treat patients, or even if it's prevention, better.
So how does that process go? Does someone call you and say, we need something? How is the conversation with the health expert?
So when I started in this field, I think it was sort of more driven by us as researchers in AI, saying, oh, we are looking for interesting cases. Let's try to contact some physicians that would be interested in this, or people within the mental health care domain. I think now it's the other way around. So people feel I have this gold mine of data. Somehow I want to leverage information in that data. So is there an AI expert that can help me? So I think it's mostly questions coming from their side, including data. But of course, we try to refine those questions a bit. Like what can we answer using the data that's available? What are the challenges that are there? How can we really make this work together with these clinicians? So I think this is typically how we go about these kind of projects.
Is there any case that you're specifically proud of an interaction with someone in the healthcare field, and then, wow, the data that they gave me really led to something cool?
That's a good question. So I think this also comes down to a challenge in the healthcare domain, I would say, namely really making this work in practice. But I think what you see specifically in the mental health care domain is that often these kind of internet-based interventions are developed, right? So these are for people that, for example, have depression and are at home and with the help of a, let's say, mental health therapist, but also with an app on your phone that can help you with exercises, understanding what's going on. So you see that there, the developments are going quite rapidly. And I think there we've contributed to these kind of interventions on the app, including AI in there. And I think I'm really proud of that is really being tried out with patients. If you look at the hospital, this is a bit more tricky to get that into an electronic medical record system to really make them work with this. So I don't think we're there yet. I did contribute to some developments that are now used in practice. But I would say in the mental health care domain, you really see that patients are using it and you also see benefits there. And I think that really makes me excited that it really works in practice.
So of course, I guess the patient is just looking either at their smartphone but they don't know exactly what's happening behind the scenes, how that data is all being reorganized and give it to them in a very digestible manner. Would you be able to break down how that behind the scenes works when it comes to machine learning?
Yeah, sure. So I think if you think about this mental health care setting, so what we do there is we try to understand when people, for example, need a motivational message or when people need a certain treatment. So people fill in how they feel, for example, and this is also what we do in Stress and Action. So these are called these ecological momentary assessments. So you ask them at a certain moment in time, like, how are you doing? What is your, how happy are you? What is your mood? And behind the scenes, right? So under the hood, all this data is then gathered in some kind of central place. And we try to understand if people are feeling bad and we send them a message, does it help them to be more engaged in a treatment, for example? Or does it discourage them from using the app again? And this AI system tries to collect all the data, so seeing what the situation is of a specific person, and then trying out, let's say, what if I send a message now? Will it be helpful? If it shows that the person then no longer becomes active in the app, it learns from that saying, oh, apparently this was not either the right message or I shouldn't have sent anything in the first place. And then it learns across patients what are the best strategies to try and engage them as much as you can. So I think this is what happens sort of under the hood.
Hopefully predict when someone will receive that message positively.
Exactly. Yeah. And you could also think of other things, right? This is one example. It might be that you already in an early stage can see that a person is sort of in a mental health perspective getting worse. And you might then want to proactively suggest a particular intervention to avoid the person from tipping over to, let's say, a negative side of mental health. So these are also the things that you could collect across many patients, seeing how their course is, and then trying to predict what do we expect to happen in the future. And this is perhaps a moment to give an intervention to that person.
So it's more about prediction, knowing when something will work based on previous data that we've collected.
Exactly.
And that makes me think about the distinction between prediction and explanation. So do you think machine learning can be used to explain why a person, for example, goes towards the more negative side of mental health? Is that a goal of machine learning, or are we satisfied with just predicting?
I think most of the work that is being done is really on this predicting. It's a bit the question whether you're satisfied with that then. So there is actually a whole field in also in machine learning that is about more causality. So understanding how things really relate to each other and what causes what other things. In a mental health perspective, this can be quite challenging, I would say, because you often only have partial information on patients or people in general. And it might be that a lot of things that you do not measure are important sort of causal effects on the mental health state of someone, right? So if you read a social media post that makes you unhappy, right? This might be a cause of a decaying mental health. And maybe we don't see that in the data. So I think all those kind of things are tricky, but I think there are techniques to try and find these causal relationships. But in general, I would say the focus is mainly on prediction. Yeah,
from a very pragmatic perspective, of course, there's always the curiosity of like, why is something happening?
Yeah.
But from a pragmatic perspective, I'm happy with it, just like knowing when something will work or won't work.
Yeah.
And I guess machine learning is very pragmatic in its goals.
It certainly is pragmatic. I agree. Yeah. And you can also think like, what would help the patient most? So on the one hand, if you would have an app that allows you to predict when something is going to happen, I think the treatment would certainly be, more effective, I would hope at least. But of course, for someone as a clinician, you might want to understand how these mechanisms work. And also for a person, of course, if you want to intervene in sort of the right way. Still, even if you could do only prediction, you can still hopefully intervene at the right moment without truly fully understanding the mechanism behind it. So I would say,
I guess it's just like you said before, it's a complement. It's not meant to completely substitute an expert, a clinician.
Absolutely.
It's just a complement, and then understanding the process might happen through different procedures.
Agreed.
So there is definitely hype around machine learning, around AI. So I'm curious as to why do you vouch for it as a powerful method to analyze all these data from like the quantified self?
Yeah, so I think indeed there's a lot of hype around it, and this happened over the last maybe 10 years or so, and of course with the rise of ChatGPT-like systems, it's even more hyped. So I think this by itself, it's been a domain in which there have been sort of 50, 60 years of development. So you really see that it is progressively sort of going faster and faster in AI, which I think is very interesting. But especially with this rise of the kind of data, for example, for the quantified self, it becomes very difficult to analyze all of that data with, let's say, more traditional methods. Especially given the amount of data, you can really unravel more complex patterns in these data, right? So you could say, okay, let's only focus on very simple things. Then AI would not be necessary. But because we have so much data, then the simple patterns actually might explain part of it, but maybe not everything. And this is a bit the explainability on the prediction again. But still, so I think it's being able to look at this complexity of data, because you have so much, I think really brings benefits for many cases, not for all. So I don't think we should always by default use AI or machine learning. But I think it is important that if we have enough data and we feel that relationships might be quite complex to analyze, then AI can really be a good tool for it, I would say.
Yeah, it also makes me think about this relationship between simplicity and complexity, which is something that we touch upon this podcast, because every time I talk to someone, it's always the thing that I come down to is, okay, everything is complex, right?
Yeah.
But in the end, what people want is a simple prompt, a more motivational message, or kind of a story that is manageable. So how is that challenging in the field of machine learning to have to handle all this massive amount of data that is very complex, but then having to summarize it in a simple message?
I think it is. So I think it's challenging for sure, but it is a model that sort of works under the hood. So I think in a sense you could say, okay, the message is being sent and you don't have to fully understand what the reason was for that message being sent. So that's perhaps a user perspective. On the other hand, if you are thinking about very sensitive people that might be fragile in a way, you might want to understand how the model works, because you don't want to send messages that might work in a negative way. So if you think about that perspective, I think that is much more tricky, because these models are getting more and more complex. So understanding exactly how a certain input results in a recommendation for an intervention is more and more challenging.
And is that a risk for the future of the field, the fact that we don't fully understand what's happening under the hood, or that the everyday person doesn't understand it?
I would think so, yeah. So I think understanding sort of these models better, I think is really one of the key research topics I would think that we should work on. Obviously, there's a lot of work in explainability of these more complex systems, but it is still really a work in progress, I would say. So, and this is also what we're working on in the group. So, Bülent Oendes, for example, who's also participating in SIA, he works specifically on explainability of these kind of complex models. So I think, this is really something that is of importance for the field, but also for the application in something like, stress detection.
Yeah. So you mentioned before the rise of ChatGPT as something that, or large language models like ChatGPT, as maybe a catalyzer for a new era of machine learning.
Yeah.
How do current developments in very novel artificial intelligence, how is that influencing the way your research is done?
So I think it does influence it substantially. So of course the methods themselves are more complex, but are also enabling you to look at more complex relationships, as we were just discussing. And what you also see is that so these LLMs, as you call them, and as I also call them, so these are essentially based on training on a lot of data, right? And while there is a lot of data out there, often in our project we have relatively scarce data, right? So you might have data from hundreds or thousands of patients, but if you think about ChatGPT, that has been trained on I don't know how many websites, but millions or even billions. And what you see in many of these works is that they train on a lot of publicly available data or websites, and you can then reuse those kind of models in a specific context where you have limited data, and then try to somehow optimize that for those patients. And this is really helpful because these models have some general capabilities. So think about recognizing things in a picture, for example, in an image. They're able to extract, like, this is a face, or these are hands, or this is the concept of, a triangle.
Because they've already been trained on so much data that you kind of trust their capacity to...
Exactly, yeah. And this is also what this new generation of models is capable of, that they learn this themselves based on a massive amount of data. And I think reusing that, right? So think about stress detection, right? Where you have some signal coming from a device that you're wearing.
Heart rate, for instance.
Heart rate, for instance, right? And what might be important there is peaks. It might be trends of some things going up or down, or and all these things. You could, these are generic concepts, so you could learn them based on a lot of other data, not necessarily only the wearable for those 1,000 patients, but maybe all kind of ECG recordings, or maybe even other types of
from the past as well, from just...
Can be anything. And then you learn some more generic concepts on things that are typically seen in these kind of time series, as we call them. And then once we try to apply it to stress, we already are capable of sort of recognizing these basic patterns. And the thing that you then learn is, how do we combine these basic patterns into, let's say, prediction for stress. So that's the final part we need to learn. And for this, you need a lot less data. So therefore, you see that really these performances really go up with these more bigger models.
So let's get specific here. Also, it reminds me of a tension in the field, which is a lot of science is basically done between people, differences between people. But now, let's say the magic of having so much individual data from yourself, from your wearables, from your devices, that you collect a lot of data within yourself, within a person. So how much data? A lot of these LLMs or machine learning models are trained on differences between people, right? Data from many people. But can that apply well to what happens within a person? Or how much data do you need from one person themselves to be a predictive model of myself? Am I making sense with this question?
Yeah. I think that's a very good question. So I think it depends a bit on, let's say, the models that you build, in how far they are. So what you hope is that you can create a generic model that's applicable to all, right? So not just to a single person, but you hope that you can find, for example, thinking about stress, you can find some generic concepts that signal stress for a broad population. However, it might be that some things are very specific to a person, right? So, and I think all these models are quite applicable also to that. But as you mentioned, you need quite a bit of data on that. And I think the challenging part is mostly, hopefully you're not stressed too often. So therefore, how often do you have a label of being stressed? That perhaps doesn't occur that often for you or for other people. And you need a lot of these sort of labeled events in order to learn properly. And if you do that across a whole group of people, then you have many of these events. If you look at a single person, you have few. However, with this sort of development of these pre-trained models, it does become more efficient. So I would say it's more and more reachable, but still challenging. And what you see as one of the examples of what people do is, so you could train on 1,000 people, and then you have a generic model, but you still try to refine it a bit to a person's specific characteristics. And where this is what is called transfer learning. So you have a generic model, and then you have a bit of data from that individual, and you try to sort of tweak that generic model to that individual. And that is even more data efficient. So that might perhaps be, indeed, offer more opportunities also for the individualized models.
Yeah, and it's working well, I assume.
In general, yeah. So of course, there's many things that are challenging, but in general, if you have, let's say, if there are good patterns in the data that might be of high complexity, then in general, these methods work well. Yeah.
Well, I guess I want to move on now to how it would look like for just the everyday user who has maybe a wearable or a ring, and the reasons for why they would quantify themselves, and then whether machine learning can help with these purposes. So I asked someone on the streets about why they use their wearables, and based on their answer, I would like to discuss with you, if machine learning can help in that. So this is Laura on wearables and her reasons to track herself. For what purposes do you use your wearables, your smartphone, to track yourself, to quantify your daily life data?
Yeah, so I think the main reason for me to start tracking myself with wearables is to improve my sleep. So I had a quite bad negative association with sleeping, with the idea that I never slept enough, had some bouts of insomnia every now and then. And I think this really helps me to gain more insights into my sleep pattern.
Great. Thanks for the answer. So very simply, for the case of Laura, can your research, machine learning, can it help for improving sleep in that sense?
So I think it can, in a way, because I think what you can do is sort of, first of all, understand the sleep patterns, but also understand perhaps what precedes sleep. For example, is a person watching the television? Was it a busy day? Is it stressful at work? So I think this quantified self enables you to really measure a lot of things around a person, not just about the sleep quality itself, but also about perhaps factors that might influence sleep quality. So, and based on all of this, if you collect that data, and for example, a wearable would typically, in combination maybe with an agenda or understanding what a person has done during a day, I think can really help in sort of making sense of how those factors relate to the sleep quality. And then if you know that, then of course you can provide suggestions saying, on days where work has been busy, it seems that you sleep worse. So maybe you should take a bit more time to unwind before you go to sleep, for example. Or this is a bit of the causality and explainability again, right? So this is a bit more of that question of understanding what the relationships are. But still, I think you would be able to give back some of the predictors for good or bad sleep, and I think this could be beneficial.
Yeah. In the sense, I also see this as exploratory. You play around with this data, and it gives you this like, well, you had a busy day at work, and that's why maybe you didn't sleep so well. Maybe try doing something.
Exactly.
I wouldn't take it as this is the real reason for why something is.
That's true.
But I guess that's also part of educating people in these and how these models work, right? And
absolutely. So I think it's hard to say anything with 100% certainty, but at least you can give an indication like these are the most important predictors. So maybe you can try to, let's say, take that into account in order to improve your sleep quality. And I think it's a very interesting, let's say, purpose that she is using it for. Because if you look at the research, then I think people often categorize the different users of this quantified self in a number of, let's say, reasons why people do it, and one is sort of the self-improvement. You could say it falls a bit under this. And you also have self-health. So it might be that you have diabetes and you want to understand how that relates to your daily exercises or
your
something like
intake,
that. Food intake, whatever it might be, right? So people try to be as healthy as they can. You could also say it relates a bit to that. But also people just like to be part of this kind of community, for example. They like to learn more about themselves, and that's another purpose. So I think this very much aligns with multiple of those purposes, I think, that people are using this for.
Yeah. Do you use wearables like this? Do you feel?
Actually, I don't.
That's
So I think
interesting.
that's interesting because I think when we started this research, obviously I bought all the gadgets that were available, but it's not for me somehow. So you can do quantified self research without being a quantified self.
It's funny. Well, I also like. More from a philosophical or theoretical perspective, I love the idea of like gathering so much data, but sometimes I get overwhelmed. And then like this thing that I said before about simplicity and complexity, like just bringing it down to, okay, what are kind of the basics? I know that sleep is a basic, good food, activity, social contact. And if I can understand that in my own self-narrative without the need of a wearable, but then it is true that a lot of people do benefit from these, and these apps are pretty cool when you just look at them and they're giving you insights that you didn't have.
Oh, absolutely. Yeah. But I think it's for some people it's really good. For other people, it doesn't work that well. So I think we should also not... I mean, people should do the things that I think fits their personality. So for me, if I look at this watch and I see that my heart rate is a bit elevated or whatever, I immediately think, oh, what's going on here?
Yeah.
So I don't think it brings me in a mentally better place. But I think for many people, these insights are very helpful. And of course, if you would have a specific reason, like I don't sleep well, then there would be more of an incentive. So I would say, personally, I'm not the person that just tracks for the sake of tracking. But perhaps if there would be a reason for me to track it, then I would be more inclined to say, oh, this is a useful thing.
Yeah, and I think from the medical perspective, it's great to have that option because there is so much that is happening that because we don't have the methods to analyze it, then it's just information that we don't get. And
absolutely. And if you also think about healthcare in general, then often things are just measurements at one specific moment, right? So if you go to the hospital, you have a checkup, you only see something that's happening at that very moment. And this really enables us to see what happens during that period that you're not in this hospital. Or if you don't see a therapist for mental health problems, right? So what is happening? And I think this really brings a lot of benefits into health.
And I think this is an interesting line to walk when it comes to this very technological world, where it's to what extent do we want to outsource our measurements, our perception of self to devices, and how much do we want to learn by ourselves or without the device? When do we use it? How do we use it? And I don't know if you have any opinions on that, or if even machine learning can guide you in when is a good moment to use the technology or when it isn't.
Yeah, well, I think that's a very good question. So I guess this is a bit outside of my expertise in a way.
More personal opinion.
I know, exactly. But so I think, I mean, it brings a lot of benefits in a health context. So I would say stimulating people to use it when there is something in their health context it can really help them with, I think is only good, right? And then indeed what you say. So perhaps AI could even. So I think the interesting thing is that you also know what are the uncertainties, right? In a way, and I think AI can also make an estimation. What if you wear it? What would I be able to say more about your health state, for example? This is not something that is often done, but also from that more philosophical perspective, you could say, well, actually, it can be helpful to also understand what it brings for a person, right? So what does the measurement help you with? And I think these kind of things are also interesting. But I would say in those contexts, I would certainly recommend using it. And then even, I mean, looking at it obsessively every minute is not a necessity, but more, as you say, getting a high-level overview, understanding what's going on, understanding what the relationships are for you between things that are being measured and how you feel, for example, or how your health state is. I think those are really important things. So really doing the micro things on let's say your watch is probably not always the best, but looking at these sort of more high level patterns that you see, I think in general can be very good to understand how, let's say you as a person respond to certain things and how that impacts your health.
Yeah, I would agree. Yeah, for sure. But then it makes me think about this goal that we have in Stress in Action, about using data that is highly accurate to provide these insights to people. But we also know that maybe the data coming in from the devices we use isn't always the most reliable or the most correct data.
Yeah.
Is that problematic for the research you do?
So I think machine learning always assumes that you never have the perfect data, and never sort of the golden standard data. So I think it's able to cope with substantial noise, but of course there still needs to be a good sort of ground signal in there. So I think in general it wouldn't necessarily be a problem as long as you can still extract the useful signal from it. And also here, of course, we don't say every second like the person is stressed or not. You look at a prolonged period perhaps, and then prolonged doesn't have to be months, but it could be hours or minutes, or and there you might still have a fraction of good quality data, so it might also say a lot. And once again, I think there's always, despite the noise, if you have enough data that you train on, you will be able to figure out like what is sort of the core of that data, however noisy, and then be able to use it in a good way. Yeah, even if it's not
perfect, if you collect enough of it.
Exactly, that's it.
In the end, it's still workable. And like we said, it doesn't have to be a certain... we don't need 100% certainty,
right?
But I guess it's good enough to know.
Exactly.
It doesn't have to be 8 hours of sleep specifically, but if it measures 7.2, and I guess that's enough.
Absolutely. And I think also the fact that it is noisy is often also predictive for, like, I don't know, if you're cycling or working out or whatever, then probably the measurements might be less accurate because maybe the phone is, or sorry, the watch is moving a bit. And based on that, that might actually also be a bit predictive. So you might not be able to measure the heart rate accurately anymore. However, you might say, oh, apparently something is happening, like the person is moving. Or so in that sense, noise can also be information.
Yeah, that's a really good point. And also there's just so much data sources. I think of location, like maybe if your heart rate isn't working well, but you do have location, then maybe you can deduct where this person is and what they're doing.
Yeah, absolutely. And I think this also brings me to sort of course, the watch measures everything without you having to do anything around it. However, also these momentary assessments that you were just talking about, this is quite a burden for people sometimes, right? If you have to fill in a question like how are you feeling 5 times a day, how long can you sort of keep that up in order to sort of understand how that relates to your heart rate, for instance? So I think also this kind of noise or the signal can help in identifying when is the moment to ask for these questions, right? So it might be that a person is in a very standard situation and you know for sure that the person is feeling well. Why pose the question? However, if you see that you're in sort of not understood territory, then it might be very beneficial to pose this question. So I think this signal can also help to minimize the burden of collecting the data, and I think that's also valuable.
100%.
Yeah.
Well, I pretty much got through all my questions today, but there's one more that I would like to ask. Maybe, I think you've been mentioning it as the episode has gone, but as a summary, what do you think your vision is for this type of research, for the machine learning work that you do, and then maybe a bit more specifically within the stress field, the field of stress science, stress research?
So I think now that we are really moving from sort of the lab, let's say, to practice, I think we are collecting more and more data that is noisier, but also richer in a way, because it's not just an experimental setting, but it's in real life. So I think from this wealth of data that we're more and more collecting, I think AI can really help to make sense of it, right? Because these patterns are very complex, and let's say the developments in AI enable you to do this effectively also when you do not have a massive amount of people that are involved in this. So I really think that for stress research, this is a super, let's say, promising area, and you already see this more and more also in research works. The AI domain is not stopping with its development, so I think it will only improve. However, there's really a few caveats that I think we should handle properly, including this explainability, including making sure that we don't have biases in these models. So there's many concerns, I would say, that come from these more complex models, and I think research also should be devoted to those domains. To make sure that we develop proper AI systems for everyone that are also explainable, so that we can put them in practice with confidence.
That sounds great. And I just wanted to thank you for coming on the show, Mark, because I learned a lot.
Thanks for having me. It was a nice conversation. Yeah.
I hope the listener also got something useful from this conversation, because in the end, it's where we are. It's the future as well. We're in a world of technology. We're in a world of now AI and machine learning. So I'm really excited to see where the field goes. And it's
same for me, I would say.
And it's good to know that you're on the job. You know.
Yeah, absolutely.
I really appreciated the conversation. And for the listeners, well, if you're interested in Mark's work, please go ahead and read his book, Machine Learning for the Quantified Self. If you want to know more about what we do at Stress in Action, please visit stressinaction.com. So thank you for listening to Stress Navigation, and see you next time.